Did you know that bowel cancer is one of the most common types of cancer worldwide? Unfortunately, this is a disease that is affecting more and more people, and many of them end up discovering it too late, when treatment is already more difficult. Therefore, it is essential that you are aware of the signs and symptoms of bowel cancer and know how to identify them. In this video, we will present everything you need to know about this disease, from risk factors, signs and symptoms to available treatment options. Stay informed with the most important information and find out how to prevent bowel cancer. After all, your health is your most valuable asset. But before we continue, like the video and subscribe to the channel. Almost 90% of people who watch our videos every week forget to subscribe to the channel, and therefore do not receive our videos with tips and a lot of information about general health that can save their lives. And those who are already part of our family, thank you very much for continuing to follow our channel. Well, now that you have subscribed and we have understood the importance of knowing how to understand the signs and symptoms of bowel cancer or colon cancer, let's continue. Before we go into detail about the signs and symptoms of bowel cancer, it is necessary to understand the importance of discussing this topic. Unfortunately, this is a disease that is affecting more and more people around the world, being responsible for about 700,000 deaths per year. In Brazil, bowel cancer is the second most common type among women and the third among men, according to the National Cancer Institute, NCA. About 41,000 new cases of the disease are expected in the country. These statistics show the urgency of discussing and raising public awareness about the prevention and early diagnosis of bowel cancer. Therefore, in this video, we will address the main signs and symptoms of the disease to identify possible warning signs. After all, early detection can save lives. What are the risk factors? Some risk factors can increase a person's chances of developing bowel cancer. These include age. People over 50 are more prone to developing the disease. Family history of bowel cancer. Inflammatory bowel diseases. Unhealthy lifestyle. In addition, diet can play an important role in the development of bowel cancer. A diet rich in processed foods, saturated fats, and red meats can increase the risk of the disease. On the other hand, a diet rich in fruits, vegetables, legumes, and fibers can help prevent bowel cancer. It is important to note that although these risk factors can increase a person's chances of developing bowel cancer, not all people who have these characteristics will develop the disease. Therefore, prevention and early diagnosis remain the best ways to combat bowel cancer. You must be wondering, after all, what are the signs and symptoms of bowel cancer? Symptoms can vary from person to person, but there are some warning signs that should be observed. These include changes in bowel habits. Changes in bowel habits, such as diarrhea or constipation, can be a sign of bowel cancer. If you notice any change in your bowel habits, it is important to seek medical evaluation. Blood in the stool. Stool with blood can be a sign of lesions in the intestine, such as polyps or tumors. Blood can be seen on toilet paper, in the stool, or in the toilet bowl. Abdominal pain. Pain in the abdominal region can indicate the presence of tumors in the intestine. The pain can be constant or intermittent and may worsen after eating. Unexplained. Weight loss. Weight loss without apparent reason can be a sign of bowel cancer. This can occur due to a decrease in appetite or difficulty for the body to absorb nutrients. Fatigue and weakness. Constant tiredness, lack of energy, and weakness can be symptoms of bowel cancer, especially in more advanced stages of the disease. Anemia. Anemia is a condition in which there is a decrease in red blood cells in the blood. This can be a sign of bleeding in the gastrointestinal tract, as occurs in some cases of bowel cancer. Abdominal bloating. A persistent feeling of bloating or abdominal discomfort can be a sign of bowel cancer. Nausea and vomiting. Nausea and vomiting can be a symptom of bowel cancer in more advanced stages of the disease. It is important to be aware of any changes in the intestinal tract and seek medical attention if symptoms persist for more than 2 weeks. Early diagnosis is fundamental for successful treatment, so it is essential not to ignore warning signs. In addition, it is important to remember that many people do not show symptoms in the early stages of bowel cancer, which makes it even more important to have regular preventive exams. Colonoscopy, for example, is an effective way to detect the disease in its early stages, when treatment is simpler and more effective. Be sure to pay attention to changes in the intestinal tract and have regular preventive exams. Your health is your most precious asset and deserves all attention and care. Prevention and diagnosis. Prevention and early diagnosis are fundamental to combat bowel cancer. The sooner the disease is detected, the greater the chances of successful treatment and cure. Therefore, it is important to adopt healthy habits, such as a balanced diet rich in fiber and low in fat and red meat. In addition, it is important to avoid excessive alcohol consumption and not smoke. Regular physical exercise can also help prevent bowel cancer, in addition to contributing to a healthier and more balanced life. In addition to preventive measures, it is essential to have routine exams frequently. Colonoscopy is the most effective method to detect bowel cancer in its early stages, when treatment is simpler and the chances of cure are greater. Do not put off taking care of your health. It is an investment that is worth it. Adopt healthy habits, have regular preventive exams, and be aware of the warning signs of bowel cancer. With care and prevention, we can defeat this disease. Treatment. If bowel cancer is diagnosed, there are several treatment options available that vary according to the stage of the disease and the patient's general health. Treatment options include surgery, radiotherapy, chemotherapy, and targeted therapies, which are medications that act specifically on cancer cells. However, it is important to emphasize that the appropriate treatment can only be prescribed by a specialist doctor. Therefore, it is essential to seek specialized medical assistance if there is suspicion of the disease or symptoms that may be related to bowel cancer. Only a health professional can make the correct diagnosis and indicate the most appropriate treatment for each case. In addition, medical follow-up is fundamental throughout the process to ensure the success of the treatment and the patient's recovery. Do not fail to seek specialized medical help if you have symptoms related to bowel cancer. Taking care of your health is essential for a full and happy life. Did you like the information we shared in this video? Then be sure to like and share it with your friends and family who may also benefit from this information. And if you are not yet subscribed to our channel, don't waste any more time. Subscribe now to receive our next videos about health and well-being firsthand. Remember that taking care of your health is essential for a full and happy life, and we are here to help you on this journey. See you in the next video.